During the pandemic, healthcare workers have been hailed as heroes, but many of those heroes have begun to hang up their capes and get out of the field. This has caused a major shortage of healthcare workers across the state of Indiana. News 10's Caitlin Hunt is live in the newsroom with how legislators plan to solve this problem.
Yes, Patrice, state legislators have noticed the thousands of open positions available in healthcare right now, and they're hoping that State Bill 1003 will help fill the gaps in the healthcare system. House Bill 1003 is determined to change the growing number of open positions in the healthcare field. The bill is proposing changes in how nursing programs are run so healthcare providers can get the workers they need. Caroline Mallory is the Dean of the College of Health and Human Services at Indiana State University. She believes this is a great piece of legislation that would benefit students and communities.
We're very familiar with the workforce needs of our communities. And we're very familiar with the available resources in those communities. And so I think the ability to tailor our programs to meet the local and statewide needs for nurses is really important.
Along with the ability for schools to craft their curriculum, the bill also includes several other provisions. Under this bill, schools could increase their enrollment rates and hire more part-time staff. Students could also participate in more simulation exercises. While Mallory believes these are great ways to motivate current nursing students, she does believe a focus needs to be placed on retaining current nurses.
I think what we're seeing with COVID is a lack of retention of seasoned nurses. And quite frankly, that worries me more than getting more new graduates out into practice.
She says those nurses are the ones who know how to care for complicated patients and extreme situations. Still, Mallory believes bills like 1003 only raise the public concern about healthcare providers. She says this bill continues to show the importance of our healthcare workers, whether or not there is a pandemic.
Nurses have been for decades the backbone of these systems, and that continues to be the case.
Now, the bill has been passed by a committee. The next step will be for it to be heard across the whole house, the full House. Reporting live in the newsroom, Caitlin Hunt, News 10.